are mixed. On the one hand, there's a perverse nature of a massive amount of influx of capital, which is generating a lot of company activity, but not necessarily going to improve the outcomes for patients. So I think the big issue is the introduction of new requirements by the federal government, which will require companies to be much more robust around their accountability towards minimum standards, around sharing of data, around the introduction of new standards by FDA so that telehealth devices will be seen as medical devices, which will force companies to do a much more deeper human-computer interaction, human factors design focus, which ultimately will take several years to really transform the marketplace. Ultimately, telehealth can only work if it truly improves the quadruple aim. That means safety of patients, quality of care, the joy and satisfaction of staff, and the overall value for the system. You can't do one or the other. You have to be able to achieve those, and that's challenging, and that's going to require some serious leadership, some better, robust governance, much more data transparency about what's working, and more importantly, what's not working. And that means companies have to be telling the truth more often, and not just shading the stuff that doesn't work, but actually saying this is what's working, this is what's not working, so that we can have a more robust public conversation on the role of telehealth as we go forward.